So yeah, we're super excited to be here. As everyone hopefully knows, Dr. Rappy and I come on Facebook live every Tuesday at 4:30.
Every Tuesday.
And we are talking about everything holistic health. Today our topic is, what is functional medicine testing? What is it? What type of testing do we offer and why? So I think we're just going to kind of jump in. We've got a lot to talk about today, and I want to thank everyone who is here joining us live.
Thank you so much.
I'm Lori Rappy from Thyroid Functional Wellness Center, and
Hi, Julie.
This is we have two Julies on.
Two Julies.
And this is
It's my Julie. Oh, hi. I'm Dr. Rappy from Thyroid Functional Wellness Center. I missed my cue.
yeah. And Dr. Rappy always has a little disclaimer.
Got a disclaimer. Let me read it to you.
Okay.
Everybody ready? Here we go. I'll clear my voice. This presentation is for informational purposes only. This information is not, I repeat, not a substitute for your medical advice from your medical doctor. This information is not meant to prevent, diagnose, treat, or cure any health condition. If you are concerned about your health condition, please discuss this with your medical doctor or visit your local ER.
Okay, awesome. Now that he walked through the disclaimer, let's go into our topic. So again, today we're talking about what is functional medicine testing, what do we offer, why do we offer it, why do we recommend it, and for those of you who are patients, those of you who follow us online, almost every time we do a video, we make reference to testing. Testing is a foundation for everything. So we thought we would just do a little deeper dive into just the testing today. So please share this with your friends and family, because this is something that everyone needs to hear. Whether you have a disease, whether you're having symptoms, whether you're not having symptoms, this is really, really important. So let's kind of dive in.
Let's talk a little bit.
What is functional medicine testing?
So let's do this. Let's do a contrast between conventional medicine or the medical models testing and what functional medicine testing is.
Sounds good.
The medical model testing is they test you, they give you a label, in other words, diagnose you with a disease, and then they treat the disease, okay? The laboratory ranges for the medical model are very, very large. And once you've exceeded that medical model range, high or low, you're in crisis mode, you get a prescription. Diagnosis, prescription. A drug to minimize your symptoms, okay?
Right.
What we're doing in functional medicine is we use a little narrower range. If you're in that range, you're healthy. Once you've exceeded what we call a functional medicine range, you're now headed toward crisis mode. So we want to preemptively strike and we want to fix it now before we get to crisis mode.
Right.
So again, functional medicine is different. The allopathic medicine or the medical model is what disease do you have and what drug do we give you. In functional medicine, it's all about identifying what's the underlying cause of the symptom. We want to address the underlying cause and correct it. The symptoms go away using all natural methods. So that's the difference between the two.
Right. Yeah. And also, and Dr. Rappy will go into more detail about what our comprehensive blood work panel is.
Correct.
You'll go to the doctor and let's say you're diabetic, they'll just test for that. We test so much more because we know the body works together and we want to find all the different imbalances, right?
That's right. So our functional medicine testing is really a foundation, or it sets the foundation and gives us a snapshot of what's happening inside your body right then, and then we can really design a roadmap moving forward to how to help you achieve optimum health and wellness. You've got to follow a system. You've got to follow, quote unquote, a roadmap to get there. So that's why we do the testing we do. The first set of tests that we run are 91 different tests that are going to test everything from your liver, your pancreas, your kidneys. They test all of your organ systems and quite a bit more. 91 different tests is a lot. And again, that gives us that foundational snapshot of what's happening, and it tells us what do we need to do moving forward to get you to a place of optimum health and wellness.
Right. Right, that's
Yeah.
exactly it.
Yeah.
So that's the comprehensive blood work panel. So for any of you that have visited our website and you see where it says get started and talks about our comprehensive blood work panel, as the doctor said, the foundational blood work, that's what we order. Can you tell us a little bit about what we're testing in that?
Yeah, so again, it's a foundational panel. It tests all the organ systems. But let me give you an example. I have an autoimmune condition called Hashimoto's, which means I have an autoimmune thyroid condition. When we test our thyroid patients or people that come to us with a thyroid condition, we're going to do 9 different tests on your thyroid. That's going to give us what we call functionality. How does your thyroid function? It's not just TSH.
Right.
Most people think TSH is actually a thyroid test. It's not. It's a pituitary test. It's testing thyroid stimulating hormone, which comes from the pituitary, and it tells your thyroid what to do. For us, that's just the minimal amount of information. We want to know what's my T3, what's my T4, how am I converting, what's my uptake into the cells, what are my free fractions, what's my reverse T3. We're looking at TPO, which is a thyroid peroxidase, which is an autoimmune marker. We're also looking for thyroid globulin antibodies, a secondary autoimmune marker. So when we see the entire panel that we run on a thyroid, we get a clear picture of the functionality of your thyroid and all the appropriate hormones that are related there. What does that direct us to? Well, if we're not converting T4 into T3, that means we could have gut issues. That means maybe we've got a liver dysfunction. Maybe we've got some peripheral cell dysfunction because we have an estrogen imbalance. There's a lot of different things we see. If we just ran TSH and T4, that's not really telling us much. So we run these extensive panels to get an idea of all of what's happening inside the body. Again, we use it as a foundational tool to identify where you are right now in time and what do we need to help you on the road to recovery and health and wellness.
Exactly. Yeah.
Yeah.
There's a lot of great information. And so the example that he gave of the thyroid. So again, it is so important to be able to identify very specifically, because then now we can look at very specific solutions for all that.
That's right.
Because we customize programs based on what we find.
Correct.
And so yes, we do look at how you're feeling and what your symptoms are and that, but to really address what's going on in here, we need to do that snapshot.
So
right?
Exactly, the snapshot.
Right.
In addition to that, let me do one more thyroid.
Okay.
If somebody comes to us and says, oh, Dr. Rappy, I've had my thyroid radiated. There's nothing you can do for me. We say, whoa, wait a second. Hold your horses there. Pull back on those reins. If your thyroid has been radiated and you're taking thyroid hormone, remember, you still have to convert the hormone. Let's say you're using levothyroxine, which is T4. It has to be converted to T3. If my liver isn't working and my gut's not working properly, and I don't convert T4 to T3, or I'm not converting the hormone I'm taking, I'm going to need to take a lot of it to get the result I'm looking for. If we clean up your gut, clean up your liver, and we increase the efficiency of your converting T4 to T3, you can take less hormone. And that's what most people want. They want to take as little as possible. So there's a lot of stuff that we do, and it's really related to looking at the labs, and they really guide us as to what's going on inside of you and what we can help you do to be as healthy as possible.
Yeah, and we really, we address it. You always hear us talking about our programs that we have. So we really look at the nutrition, the detox. So what the doctor is talking about, your improved liver function, your gut function, all that. We do a clean, cleanse, and repair to your organs, your cells, and get your body to a great foundational place. So really your body can now benefit from the supplements he's going to recommend, from the nutrition we're going to talk about, the stress management tips and tools that you need to implement every day, to the exercise and movement. There's not just one pill, there's not just one supplement, there's not just one answer. You know, we're a whole body that works together, and we've really got to look at all these different functions. The testing is so important, right? It is so important.
To give you another example is when we see people recently in the last year, what we're seeing is a lot of our clients come in and their vitamin D levels are really low.
Right.
Well, they say, well, I go outside. Well, you're wearing sunscreen because you don't want to get a skin cancer. So that it blocks your ability to absorb the vitamin D from sun. We've got to take supplementation. If I take a D supplement, but my liver isn't converting it into the useful form, I'm going to have a low D. Why is that important? Vitamin D is important for brain function, bone density, but it supercharges your immune system. That's why we've seen the majority of people that have been hospitalized from COVID had low vitamin D levels. So it's really important to look at all of it as a whole picture.
Right. And while we're talking about the supplements, so definitely the vitamin D, we all need to be just cranking that up right now just to be preventative.
Correct.
And then the other piece is we see a lot of people who they're like, I'm taking all these supplements. Do I need these? Well, what's the best way to determine if you actually need them is to
do the testing. So we hear this a lot. They'll come in and they'll have an entire sheet full of supplements. And I'll say, why are you taking all this? Well, I read about it in a magazine. My sister's daughter's boyfriend is taking a class over at the university and they thought I should take this. And next thing you know, you've got an entire list of supplements that you don't really need. So our testing is very specific and it tells us what your body actually needs to function normally. Right. We want to get rid of the stuff that we're taking that we don't need. It's not only a waste of money, but your body should be spending its energy doing other things than metabolizing this supplement that you don't need.
Right, right. And maybe you do need some of them, but by doing the testing, and what's so interesting about the testing is we're talking about it all the time. The doctor talks to the patients that come in the office. Julie in the front is talking to people about the blood work. They'll see a video in our lobby. And I have the discovery calls with people. And what I'm really finding is there's a lot of people who've been dissatisfied with their medical doctor, so they just haven't gone anywhere. They haven't done blood work in a while. And if you know anyone who is in that situation, they really should contact us to get their blood work. It's such a good baseline and foundation for what's going on. So that's, one scenario. Another scenario is you do have the symptoms, you're on a medication. And so now we want to do the testing to see where you're at, what other imbalances are going on. But you don't necessarily, the third option is you don't necessarily have to have any of the symptoms, any of the known diseases, taking any of the medication. Okay, I see you sent that message, Susie. I will read that afterwards. And you don't need to necessarily have any of those red flag symptoms, but let's do a yearly, we do it between like every 6 months, every 8 months. Let's see where your body is at. So you could be eating well and trying to do all the right things, but then stress hits, anxiety. We're seeing everyone right now has a high level of anxiety, a high level of stress. And you've heard me say this before, we really don't give stress enough credit for the damage it does to our body.
Horrible.
So we've had the stress, we've had changes in our life, whether it's, inside changes around us, environmental. So let's do the blood work so we can see how it's affected us and our numbers.
Absolutely.
Right?
Now let's go back to real quick for stress. When I have a lot of stress, my cortisol levels go up. High levels of cortisol actually block the conversion of T4 to T3. That's thyroid hormone. So if I've had radiated thyroid and I'm taking levothyroxine or Synthroid, that's a T4 product, and I have high cortisol, I'm not going to be able to convert it to T3, the useful form like I should. I'm going to have a lot of stuff going on in my body that's not normal. A lot of dysfunction in other areas. Why? Because cortisol is going to block the conversion of T4 to T3. So therefore, we've got to work with getting that cortisol level under control so it doesn't reduce the ability for your body to use the hormone that you're taking.
Right.
Okay? So stress plays it wreaks havoc everywhere in the body. Really does.
It really, really does. And so the comprehensive blood work panel is really a great foundational test. And once someone starts to work with us, we do a saliva test that is hormones and cortisol, kind of what the doctor was just talking about. And so can you tell us a little bit about that test?
So with the saliva testing we're going to do, we use saliva testing because that gives us what we call tissue saturation levels rather than blood levels or urinary levels. We're looking at cortisol 4 times a day because cortisol is a circadian rhythm hormone, meaning that it should be high in the morning and low at night, and that can get out of whack, okay? It can be thrown off. And when that happens, it's going to change your body's physiology throughout the day. You might be really tired in the morning, a slow starter because you have low cortisol levels, and you don't sleep well at night because you have high cortisol. So we're testing cortisol. We're going to look for DHEA because DHEA is upstream, what we call upstream from sex hormones. We're going to test 3 different estrogens. We're going to test testosterone. We're going to test progesterone. We're going to test an SIGA marker. We're also looking at gluten sensitivity because we know that gluten is going to drive leaky gut syndrome.
Right.
And lastly, we're looking at a saliva, insulin levels, and H. pylori, which is a bacterium in the gut that can cause peptic ulcer symptoms.
Right.
So we're testing a lot in that secondary test that we run with our clients. It's an amazing tool that, again, helps us understand where are we hormonally and what can we do to get you into balance.
Right. And what people really enjoy about working with us is not only does the doctor go through the results of the test line by line, but then we offer holistic solutions. Every single day we see people who say, I went to the doctor said I was fine, and I'm like, I'm not fine, I don't feel well.
Right. Or they say, your labs are in the normal range, you're okay.
Right.
Well, their normal range could be at a place where you have symptoms still. You just haven't hit crisis mode.
Right.
So that's what we do. And like Lori said, when we run these blood labs, I literally sit down and go through every single lab that we run, every test in the lab, and tell you what it's for and what's it telling me so you understand what's going on. It's really important.
Yeah, we get you very involved in the process because we're working together. This is definitely teamwork. We can't do it on our own. We offer the support, we offer the coaching and the guidance, but you have to be in a place where you know, I need to do something different.
Right.
And Oshana, low end of normal, why not be at the high end of normal?
Exactly.
That's exactly
I want to be
it.
optimum at everything.
Right.
Optimum.
Right. And I don't want just for the doctor to say, oh, it's fine, it's a little elevated. Well, let's do something now. I don't want to wait till it falls off. I fall off the cliff, the number falls off. I want to address it now. Preventative is huge. And what we do every day, and kind of what a lot of us have been doing during this COVID scare as well, has been very preventative by building up our immune system and doing the things that we know we can do for ourselves. So
in addition to that, well, let me talk a little bit about specialized testing, because when we see a client, we want to deal with the issues that they're struggling with. And as we get them to a healthy place, they may say, look, Dr. Rappy, there's a family history of Alzheimer's, right? And so I'm really concerned about that. So we do have access to specialized testing. We use a company called Cyrex, and they have everything from, they can look at Alzheimer markers, they can look at SIBO, which is small intestine bacterial overgrowth, and IBS, and they look at blood-brain barrier breach and hyperpermeability of the intestines, and they look at food sensitivities. They got an incredible food sensitivity testing. So there is all this specialized testing that's available, but we don't run it typically right away, because let's fix what's going on first and then look to the next step of, how do I know what I'm allergic to?
Right.
Well, let's find out. In my case, as a thyroid autoimmune person, there's 2 foods that drive my immune system to attack my thyroid. And most people on here would probably say, wow, that's really good stuff. Salmon and blueberries, which 2 are the healthiest foods that any human being can eat, the good proteins and the good omegas in the salmon, and then the antioxidant properties of blueberries. But those 2 items drive my immune system to attack my thyroid. So I stay away from those. I don't eat them, period. And I've been able to keep my autoimmune in remission by doing that.
And sharing that example is so important because everyone's body is different. Once we get our eating cleaned up, we can see where there could be good foods that are triggering you.
Correct.
Just because, so the salmon and blueberries, I can eat salmon and blueberries, they don't bother me, but there's foods that bother me. So it's very individual, and that's why it's so important to get the testing done, get the foundation of what's going on, and then like I said earlier, we work with you. We look at everything, the nutrition, the movement, the exercise, the stress management, the supplements, the detox. It really is a whole body approach, but
it's customized to you as an individual because not everybody's the same. Like she just said, I cannot eat salmon and blueberries, and she can. So we have to customize based on laboratory testing. We customize a program that's what you need, what you want, and what your desires are. Not everybody has the same goal. So we make our programs customized to you as an individual. It's not a cookie cutter where everybody gets the same thing.
Right, exactly.
Yeah.
And so, what's nice is with the Cyrex testing, there's a whole list of advanced testing that we could run if necessary. Other autoimmunes, if you want to identify those. There's a lot of different things that are available. But again, we like to start off with that comprehensive blood work panel. And you could always contact our office for more information. I have the link to our website as well that gives information, and also set up a free call with me.
Right.
Just talking for a few minutes, we can have a nice little banter. I can ask and find out what your health goals are and see if this would be a good fit.
Yeah. Not everybody's the same. Again, it's all about what we can do for you. Everybody has their own needs, wants, and desires.
Right.
And so our job is to take you where you're at today and help you achieve optimum wellness, whatever that looks like for you.
Yeah, and something that just came up for me that I want to share is that a lot of people, I hear this from a lot of people, I'm really busy. I have so much going on. I'll do it next week. I'll do it next month. I'll do it here. What's really important about the work that we do is we meet you where you are. Hopefully we all have busy lives. If we wait to take care of ourselves until we're not busy, what's going to happen? Probably an episode of some sort that you don't want to happen. So the time is now. No matter what's going on, it's now. And working with people like ourselves who can meet you exactly where you are, because you have to learn how to take care of yourself while you're busy, while you're working, while you're taking care of other people, while you're traveling, whatever it is that you're doing. You take you with you everywhere.
Right.
And so it's learning how to take care of you. So that's really a big thing I wanted to share.
Yeah, it's about thinking along these lines. I have a nephew who's a researcher, PhD researcher at the University of Minnesota, and we had a great chat this weekend, and he said to me, if we can stop now what's coming in the future or address it now what's coming in the future, we control the outcome. Fascinating.
Oh, I love that.
Rather than wait for it to happen and try to go backwards, if we can take steps today so that it doesn't happen, we change our future and our outcome. And that's really what everybody in our country should be doing right now.
Right.
Right?
Let's just not be reactionary.
Exactly.
Oh, I have a disease. Now I'm going to do something about it. That's why I said at the beginning, it's so important to keep running this blood work. Don't wait for symptoms. Let's see what's going on and let's do something about it.
Do something.
That's the key.
Take action.
Take action.
Take action. We're all about action here.
Yeah. Yes, we are. And we're about timing.
Out of time.
I'm always so mindful of everyone's time. And so
mindful.
We're so appreciative of everyone who is joining us live. I hope you learned something about testing. If you have any other questions, please reach out. I'm happy to answer any of those questions. And for those of you watching this recorded, thank you so much for joining us as well.
Thank you.
Next week, next Tuesday, we are going to be talking about what eczema, psoriasis, RA, and Hashimoto have in common.
Holy
so you'll have
smokes.
to join us next week to see what that is. And I have an amazing lineup of September Tuesday Facebook Lives for you as well. So September is a special month because it's my birthday month. So we're going to be doing
birthday
some
month.
fun.
Did you guys hear that? Not day.
Yeah, no.
Month.
It is. Yeah, it's the month. And so I'm going to be sharing some really fun things as well. I'll talk about more next week. Please share this information with your friends and family. You know, for us, our goal is to help you have the best life, the best health, and to know that you don't just have to settle for how you feel. There's an alternative.
Yep.
There's solutions. So thanks, Shauna. Yeah, birthday month. Woohoo! We know. Love September. All right, everybody. I hope you have a fantastic evening. Again, if you have any questions about testing, reach out. We're happy to answer them.
Yeah. Reach out. We're here.
Sound good?
Our mission is to help as many people as we possibly can. That's our passion. We love it.
Yes.
We love you guys. Thanks for coming on today.
Yeah,
we'll
thanks.
see you next week.
All right. Bye, everybody. Have a great
Bye.
night. Bye.